Hi everyone, I'm Donna. Today, me and my friends Suha and Sarah are going to talk about diabetes. A person who has type 1 diabetes, their body is unable to produce insulin, which is a hormone that helps regulate blood sugar levels. The immune system incorrectly targets the insulin producing cells in the pancreas, which is typically the cause of this. Insulin must be taken daily by people with type 1 diabetes in order to control their blood sugar. Let's talk about the causes of diabetes. Type 1 diabetes can be caused by an autoimmune response leading to the selective destruction of pancreatic beta cells, responsible for insulin production. Also, a new research indicates that early exposure to gluten, along with other dietary factors early in life, may affect the risk of developing type 1 diabetes. Finally, a person's risk is increased if type 1 diabetes runs in their family, which implicates genetic factors as well.
Symptoms. Type 1 diabetes has several noticeable symptoms. The first is polyuria, which means frequent urination due to excess sugar in the urine. This leads to polydipsia or extreme thirst as the body loses too much water. Then there is polyhia, excessive hunger, because the body cells are starved of energy. Other symptoms include unexplained weight loss as the body burns fat and muscle for energy, and fatigue and weaknesses from lack of glucose in the cells. Over time, complications can lead to vision loss, kidney disease, nerve damage, and slow wound healing. Diagnosis. To diagnose type 1 diabetes, several tests are used. The fasting plasma glucose test checks blood sugar levels after at least 8 hours of fasting. A level above 126 mg per dl suggests diabetes. The oral glucose tolerance test measures blood sugar 2 hours after drinking a glucose solution. Above 200 mg per dl confirms diabetes. The HbA1c test shows average blood sugar levels over months, with 6.5% or higher, indicating diabetes. Other tests like C-peptide autoantibody tests help distinguish type 1 from other types.
Treatment. The most commonly prescribed medication for T1D is insulin. There are also new insulin analogs available. Optimal glycemia control requires multiple doses of insulin that copies the physiological insulin release. It consists of basal insulin for overnight and between meal control, plus bolus doses of rapid-acting insulin analogs to cover ingested carbohydrate loads and treat hyperglycemia. Insulin can be taken by injection with an insulin pen or preferably for many people with an insulin pump. Patients with type 1 diabetes are also prescribed a non-insulin medication like pramlintide for improved glycemia control. Fewer than 5% of the patients with T1D can also be treated with metformin, glucagon like peptide 1 receptor agonist, dipeptidyl peptidase 4 inhibitors, and sodium glucose cotransporter inhibitors. Conclusion. Diabetes is a serious life-threatening disease and a huge burden not only on the patient but also on their family, community, and the country. All types of diabetes should be detected as early as possible and managed accordingly to prevent its progression and complications. It must be constantly monitored and effectively subdued with proper medication and by adapting to a healthy lifestyle. Thank you for listening.